Coronavirus belong to the family of viruses that cause conditions like the common cold and other respiratory conditions. Preventative measures can help you protect your health in public, at home, and while caring for a sick person. If you think you have the virus, contact your doctor immediately. Wash your hands with warm water and soap to minimize your infection risk. Wash as often as possible. Wet your hands with warm water, then apply a mild soap. Work the soap into a lather for 20 to 30 seconds, then rinse your hands clean under warm running water. Wash your hands before you eat or drink anything. However, it's also best to wash your hands anytime you're out in public or after you're around someone you suspect may be sick. If it is not possible to wash your hands, use a hand sanitizer that contains 60% alcohol. Keep your hands away from your mouth, nose, and eyes. You may come into contact with the coronavirus on a surface, like a doorknob or countertop. When this happens, the germs can linger on your hands, so you can easily infect yourself if you touch your face with dirty hands. Avoid touching your eyes, nose, and mouth in case the virus is on your skin. If you need to touch your face, wash your hands first so you're less likely to infect yourself. Stay away from people who are coughing or sneezing. Since coronavirus is a respiratory infection, coughing and sneezing are common symptoms. Additionally, coughing and sneezing both release the virus into the air, so they may increase your risk of infection. Keep your distance from people who appear to have symptoms of an upper respiratory infection. If it's appropriate, ask the person to stay away from you. You could say, "I noticed you were coughing. I hope you feel better soon." Recent reports indicate that coronavirus may be transmitted by people who aren't symptomatic, so staying away from people who are coughing and sneezing isn't necessarily a guarantee, though it's still good practice. Try to exercise caution around anyone who may have been around other sick people recently, too. Disinfect high-touch surfaces daily using a product that kills viruses. Unfortunately, coronavirus can linger on surfaces, such as doorknobs, countertops, and faucets. This limits the risk of the virus lingering on the surfaces and potentially causing an infection. In your home, disinfect your front doorknob, kitchen counters, bathroom counters, and faucets. At work, clean surfaces that people tend to touch, such as doorknobs, stair railings, tables, and surface counters. You can also make disinfectant by mixing 1 cup 240 milliliters of bleach with 1 gallon 3.8 L of warm water. Try not to worry too much if you're not truly at risk. Myths about coronavirus have spread on social media, sometimes causing unnecessary fear. It's helpful to fact-check your sources before making any decisions. There's no need to assume, for example, that contact with a Chinese person will give you a disease. Chinese and other East Asian people have been facing unnecessary discrimination. But most of them are healthy, and aren't necessarily more likely to spread diseases than anyone else. Lists of foods to avoid are not necessarily factual. Put on disposable gloves, a face mask, and a paper gown before you care for the sick person. When you leave their room, take off your protective gear and throw it in a plastic trash bag. Don't reuse your protective clothing because you may accidentally come into contact with the virus. Coronavirus spreads through the air and can linger on your clothing, so protect yourself as best you can. Don't share household items with the infected person. Coronavirus can linger on items like cups, plates, utensils, and towels. Use separate items for each member of the household while someone is sick. Otherwise, you might accidentally spread the infection. When in doubt, wash the item before you use it or get another one. Avoid eating raw or undercooked animal products and exercise care when handling raw meat, milk or animal organs to avoid cross-contamination with uncooked foods. Masks could help lower the risk of contracting a virus through the splash from a sneeze or a cough and offer some protection against hand-to-mouth. The consensus appears to be that wearing a mask can limit, but not eliminate, the risks.